An ICU doctor sued Sentara Norfolk General Hospital to allow him to prescribe ivermectin to his COVID-19 patients. The hospital banned the practice after the FDA and CDC warned against it. On its website, the FDA explains on this page that it approved ivermectin to treat worms, head lice, and skin conditions like rosacea. But data do not show ivermectin is effective against COVID-19, adding that clinical trials are ongoing. Norfolk physician Paul Merrick, however, maintains his COVID treatment using ivermectin and other substances saves lives. CBN News first interviewed Merrick in 2017 about his groundbreaking treatment for sepsis, although he declined to talk about his ivermectin treatment on advice from his attorneys. The treatment, entitled Math Plus, is described on the Frontline COVID-19 Critical Care Alliance website, an organization Merrick co-founded. Also on the website, ivermectin research from other countries showing its effectiveness in treating COVID-19. Dr. Merrick asked a judge to force Sentara Norfolk General to let him provide ivermectin to his COVID patients.
He died a month after he turned 60 in the hospital.
Outside the courthouse, Merrick's supporters protested the hospital's ivermectin ban, including a woman who says her husband died when a different hospital refused to allow Merrick's treatment.
I begged every single doctor that came in contact with my husband for 36 days, and we were denied every time.
Another woman said her critically ill husband was denied ivermectin at hospitals in Lynchburg and Charlottesville, Virginia.
The doctor that I talked to told me that ivermectin was dangerous and that they would not administer it. It was not approved by the FDA for COVID.
Some doctors who prescribe ivermectin in their offices believe hospital physicians should be given the same right.
Our patients should never be denied treatment by a hospital administration or the government. It is only in COVID that this has changed and that the hands of physicians have been tied around this country, and we've been prevented from giving treatments that we believe would help a patient.
Sentara Healthcare responded to Dr. Merrick's lawsuit by saying, in most situations, physicians are able to deviate from guidelines to individualize care for patients. However, in some scenarios, treatments that may potentially harm patients or that are widely considered to be outside the standard of care may be limited. A judge denied Dr. Merrick's request to immediately begin prescribing ivermectin to his patients. The case may go to trial next year. Meanwhile, other cases like it have been resolved with mixed results. The American Bar Association reports in 3 cases hospitals were forced to allow ivermectin treatment, and in 4 others, bans on the drug were upheld. Lori Johnson, CBN News.